Yeah, good morning, all. I request all the participants kindly be patient for e-certificate. We will be posting the link for e-certificate around 12 o'clock in the noon and enter the patiently without any single mistake in email. You will get e-certificate every day 100 only. So wait for at least 5 days for your term. If you won't get after 5 days also, kindly mail me at inspectordrugs@gmail.com or message me by WhatsApp at 812129637. Thank you.
சொல்லுங்க ப்ரோ. Reddy sir, good morning.
Good morning, sir.
Rajshekar, are you there? Rajshekar?
Not a join, sir.
Ranjit sir, good morning.
Good morning. How are you, doctor?
Yeah, fine, sir.
Good.
I just spoken to Yavale sir, and he will be joining from his iPad.
No problem.
Yeah.
Yes, sir, good morning.
Good morning. Good morning. Ensure nice introduction of Dr. Pramod.
Nishit? Nishit?
Yes, sir.
You observe immediately. The moment Yavale sir entered, we will start.
Pardon, sir?
చూసుకుంటా జూమ్ చేయి
The moment chief guest enters,
చూసుకుంటా
we will
కొంచెం
start.
జూమ్ చేయి
Yes, sir.
And your signals are good, no?
కొంచెం ఇది పర్ఫెక్ట్ సార్ స్టాండ్
Your signals are good.
Yes, sir.
ఇట్లా
ये डिस्टर्बेंस क्या है? ये फैन डिस्टर्बेंस। ये जो साहब बैठे हैं उनके उधर फैन चालू है, उसका डिस्टर्बेंस है।
Mr. Reddy, is there any fan?
బట్ ఐ హావ్ ద హెడ్ ఫోన్స్ ఓవర్
So you put off your fan.
Yeah,
Later.
now it is silent.
Hmm.
Rajashekar,
Sir.
I think NASA sir also coming to the picture. If he comes, make him also host.
Yes, sir.
Give him 2 minutes to speak.
Okay, sir. NASA sir is co-host, sir.
Ah.
Sir, already joined, sir.
Good morning, Atul ji. Where are you?
Good morning. Good morning.
Nice to see you.
Yeah, welcome. Welcome.
Sir, good morning, sir.
Good morning. Good morning.
Sir, a small change, sir, NASA sir.
Yes, yes.
Instead of giving welcome speech by Koteshwara, I am shifting to national president. I will speak only in introduction of chief guest.
No problem. I am at Goa. I will join for 10-15 minutes only. Okay.
So that's enough, sir. Welcome, sir.
Okay.
By national president.
Yeah. Sure.
You check in A and P also, Rajashekar.
Yes, sir.
Either in the name of Pramod or Yavale. P or Y, sorry, P or Y.
Morning, all of you, sir.
Good evening, good morning.
Good morning, Jaybalan sir.
Sir, good morning. Good morning, sir. Good morning, sir. Atul Nasa, sir. Ranjit Bajka, sir.
Good morning to you, doctor. How are you doing?
Fine, fine, sir. We are fine. Thank you, sir.
Good.
Morning, Atul Nasa, sir.
Good morning, Ji. Good morning.
Good morning.
Good morning, Rajesh, sir. Good morning, Yule, sir.
Sir, you can join, sir. Okay, we'll make you both. And which name, sir? Okay, thank you. Yeah, okay, we made you co-host, sir.
Pramod sir already joined, sir.
Okay. Yeah. Sir, let us start, sir.
Yeah, you can start.
Sir.
Good morning, Evle sir.
Good morning. Good morning.
Good morning.
to one and all.
Yeah, good morning. Good morning, dear all. May I request our National President, Dr. Atul Kumar Naza, to give welcome address of this August gathering. Over to Dr. Atul Naza, sir.
Thank you. Thank you very much, Mr. Koteshwar Rao. And very good morning to all the participants. It's my privilege to welcome each and everyone to this webinar organized by IPGA South Zone Branch. The chief guest of the day, Dr. Pramod Yole sir, Acting President of Pharmacy Council of India. We welcome you, sir. Thank you very much for sparing your valuable time.
Thank you.
Thank you. Most welcome, sir. Most welcome.
Thank you. Thank you.
The speaker of the day, Mr. Ranjit Barshikar, sir, advisor of United Nations. And we have listened to Mr. Ranjit in the past in different webinars, and he gives the excellent presentation. And today's topic, pharma career opportunities and challenges. This is the need of the hour, and we welcome Mr. Ranjit, sir, the moderator of the.
Thank you.
Thank you. Thank you. Welcome, sir. Welcome. The moderator of the program, the president of IPGA Andhra Pradesh branch, Mr. Vijay P. Annapeledi, sir. We
Thank you, sir.
welcome Mr. Vijay also as a moderator, and the coordinator for this program, Mr. Nishit and Mr. Rajshekhar. They are going to coordinate. We welcome Mr. Nishit and Mr. Rajshekhar, and definitely, of course, last but not least, the dynamic person, Mr. Koteshwar Rao, the South Zone coordinator for excellently arranging different webinars from time to time. Simply, I can say that during this COVID time or during this pandemic time from last 2 years, when the entire world is suffering, but pharma profession, pharmacy professionals are playing a very vital role. And the theme of this webinar, pharma career opportunities and challenges. Now see, professional working in different field of pharmacy profession, whether it is research and development, quality control, quality assurance, hospital pharmacy, community pharmacy, clinical pharmacy, regulations, academic, clinical trials, medical devices. Each and every pharmacist is playing a very important role. And I hope the presentation given by Mr. Ranjit Barshikar after my, this welcome address, it will be definitely helpful to each and every professionals and all the pharmacy graduates. With these remarks, I welcome you all and my best wishes for this webinar on the topic Pharma Career Opportunities and Challenges. Thank you very much.
Thank you, sir. Thank you. Good morning, everyone. G. Koteshwar Rao, President IPGA Telangana and Coordinator IPGA South Zone. On behalf of IPGA National, Dr. Atul Kumar Raja, sir, along with moderator Mr. Annapareddy Vijayabhaskar Reddy, IPGA Andhra Pradesh Branch President, and Dr. Nishit, Dr. Rajshekar, welcome you from core of my humble heart for today's webinar. Firstly, I thanks to today's chief guest, Professor Dr. Pramod Yawale, sir, President in charge Pharmacy Council of India, to the session. I welcome, sir, and I express my overwhelming joy in inviting today's keynote speaker, Mr. Ranjit Barshikar, sir, CEO, QBD International, United Nations Advisor, Geneva. Pharma sector is a great domain to make prosperity while establishing safety and healthy security to patients all over the world. From centuries, pharma has always proved its stand during several pandemics like the one we are facing now, COVID-19. We always, as a pharma community, shown our concern to the world in making physical, mental, and social health of mankind strong through times happened and the times to come. We always were blessed with an opportunity to learn and update ourselves to fight against the odds and in delivering prognostic, diagnostic, and therapeutic domains. It's always been a new era for the pharma sector and thereby always was ahead in providing several opportunities to job seekers in the field of drug discovery, formulation development, marketing, and logistics. Now the opportunities have expanded with increased sophistication in the scientific approaches in the field of bench side orientation, representing the production to bedside orientation, representing the clinical approaches. Quality and quantity are now going hand in hand by having a huge growth in technology and human knowledge as well. Though we have reached to superlative levels in technology due to the availability of software, sophisticated machinery, we still need human experts and scientific understandings to go to extreme heights in pharma field with parallelly providing job potential for young minds. Today, we have such wonderful opportunity to learn how we can have a conjuncture to make meet the two diverse aspects of sophistication and modernization of equipment with the job provision in the huge field of pharma. Today's webinar focus on the burning issues of pharma opportunities and the underlying difficulties which will be thoroughly handled by our respected keynote speaker, Sri Ranjit Barshikar. Before that, I will be great honor, pleasure to invite our chief guest of today's session, Professor Dr. Pramod Yawale, sir. And it give me privilege to introduce our chief guest, Dr. Professor Pramod Yawale, sir, holding the highest position of pharmacy profession regulation, that is acting president of the Pharmacy Council of India, PCI. My first and sincere thanks to Dr. Yawale for accepting to our chief guest, which I personally feel that many unemployed and career enhancement aspirants be definitely proud to have their highest chair of the country for the profession of pharmacy in this session. I introduced that Dr. Yawale is presently working as Vice Chancellor of Dr. Baba Saheb Ambedkar Marathwada University, Aurangabad. Dr. Yawale, born in 1st January 1959 and completed his Masters in Pharmacy, subsequently PhD and DPM. Beyond and being acting president of the Pharmacy Council of India and Vice Chancellor of Dr. Baba Saheb Ambedkar Marathwada University, he is also holding enacted several prestigious positions that pertain to various academic, regulatory, or technical bodies of the nation, such as is the present chairman Pharmaceutical Education Board of AICTE, past member, Executive Council, AICTE, Executive Council member, Mahatma Gandhi International Hindi University, Wardha, member, Board of Governance, Naipur, Raebareli, Uttar Pradesh, was professor and principal, Institute of Pharmaceutical Education and Research, Wardha, was pro-vice chancellor for Rashtra Sant Tukadoji Maharaj Nagpur University, Nagpur, vice chancellor acting Kavi Kulaguru Kalidas Sanskrit University, Ramtek, Nagpur. I further to claim that he is having esteemed expertise teaching research and academic administration. Further to quote, his teaching experience is about 33 years, books written are 3, awarded more about PhDs are 19. Apart, he filed 5 patents in which 2 are already granted. He is a great scholar with the publication of 18 articles and acted as a PG student guide for about 100 numbers. He also published 55 research papers and chaired about 21 scientific sessions. He enacted as head in 8 major research projects and also about 85 industrial. He is life and honorary member in many national international ship of professional societies bodies and traveled several countries as part of his career such as Malaysia, Singapore, Australia, Hong Kong, Nepal, China and Europe. Dr. Yovale has backed up many academic awards and honors such as India's top 20 eminent vice chancellors for the year 2020. He was a GP Srivastava Award of Association of Pharmaceutical Teachers of India 2019, Indian Pharmaceutical Association Fellowship Award 2013, Jeevan Gaurav Puraskar 2012, Maharashtra State Teacher Award 2009-2010, Maharashtra Pharmacist Association Award 2009, Rashtra Sant Tukdoji Maharaj Nagpur University Ideal Principal Award 2007, Association of Pharmacy Teachers of India Principals of the Year Award 2006, Alumni Achiever Award 2003 of KMK College of Pharmacy Mumbai, Raja Ram Bapu Patil National Award for Promising Engineering Teacher 2002 of Indian Society for Technical Education, Maharashtra State Pharmacy Council Award 2000, Best Teacher Award of Lions Club 2000, Mahendra Talent Research Scholarship and so on. Before I request Dr. Yovale sir, today's chief guest, to address this August gathering, I request all the co-hosts, please mute your phone, please mute it, so only the guest will speak when when the guest is speaking. Please, sir. Over to Professor Dr. Yovale, sir.
Thank you, Dr. Koteshwar Rao, for a nice introduction. Is it audible?
Yes, sir.
Okay. Okay. Thanks for a nice introduction. National President of Indian Pharmacy Graduate Association, our esteemed colleague, Executive Council Member of Pharmacy Council of India, Dr. Atul Nasaji. Today's keynote speaker, Mr. Ranjit Barshikar, CEO, International United Nations Advisor, Geneva, and member of Editorial Board General of General Medicine UK. Organizer of this event, Dr. G. Koteshwar Rao, other office bearers of Indian Pharmacy Graduate Association, other dignitaries present here, and participants, ladies and gentlemen. At the outset, I'm very much thankful to Indian Pharmacy Graduate Association South Zone for inviting me and for giving me an opportunity to interact with a budding pharmacist and pharmacy professionals. They have organized a national level webinar on very vital topic, that is a pharma career opportunities and challenges. Friends, most of the students I think have joined here. Firstly, I congratulate to all of them on this auspicious occasion for joining this noble profession. Friends, you have adopted the profession of pharmacy of your own choice, and thus you have loyal and committed to the pharmacy professions, since your lot depends upon how the profession makes the progress. After graduating, you have to make plus your depends on the two factors. First, that is your inherent liking for a particular field of a profession, and second, of course, on the basis of emolument. No doubt the financial status is very important. Nothing works without money in today's materialistic world. At the same time, for your own satisfaction in life, you have to choose a particular field of you have got liking. The choice is your, either go for the money or for an inherent satisfaction. You should have no regret. Once you have chosen a particular field, you have to put in your best to be successful. This is what Dharma teaches, that one should put his efforts for excellence, for which he has been destined or have been placed before the circumstances. Satisfaction does not come with an achievement, friends, but efforts, full of efforts is full victory. If you see the history of a pharmacy profession, the first college of pharmacy was established in Goa 800 years back. Then the regular course of pharmacy started in India in 1932 at Banaras Hindu University. That was a 2 years graduation course. Before independence, only 3 colleges were there, but now around 3,500 colleges are there. If we see the growth at India, 3,500 plus colleges, pharma institutions are offering the different courses like DPharm, BPharm, MPharm, post-graduation, PharmD, and also the PhD programs. And in these colleges, around 85,000 faculty is working. Around 4 lakh students yearly enrolled to these pharmacy institutions. At present in the country, 15 lakhs graduates are there. The pharma profession is governed by 9 regulations, and we offer the 5 programs. Friends, the growth of the pharmacy is rapidly increasing. The scenario of pharma is changing continuously. There is an assured growth in the healthcare and pharmaceuticals, and there are reasons for the same. The different reasons, as per my analysis, first, that is the increasing population. The population is increasing day by day. At present, we are around 140 crores. Second thing, awareness amongst the health regarding the health is also increasing in the society. Third one, life expectancy is increased. Earlier, at the time of independence, the average life was 42 years, but now it is a 64 plus. The next one, that is the health insurance schemes are also coming. And another one, that is the rise in a private health care. These are the reasons how the pharmacy is getting a choice of students. As per the statistical information provided by the Health Ministry, around 70,000 jobs are available per year in the country. But the second aspect, the quantitative growth we have achieved, but there is a big question mark on the quality of a product which this pharma institutions are producing. In the last decade, around 1,500 pharma institutions are came in the different regions. The highest number is a southern, next one is a western, next one is a northern, another one is a eastern, and last one is a northeast in terms of a number of institutions. The number of institutions are increased, but somewhat the quality is deteriorating. We all the academicians must concentrate on this, and Pharmacy Council of India has taken this task very seriously. And we are thinking that our motto of a Pharmacy Council of India to increase the academic standard, that we should close the institutions, but we want to streamline. To give justice to the academics, the institution must have a required qualified faculty. The faculty must get the prescribed pay scales, and they must have the required infrastructure like the equipments, instruments, library, and other facilities. While when we start the approval process for the 22-23, definitely we'll concentrate on all these things, and we'll try our best to increase the academic standard of the pharma institutions. Because the growth of the pharma institutions, as I said earlier, pharma industry is growing at a faster pace across the globe with a market of around 1.3 trillion US dollars in January 2019, which is likely to touch 1.5 trillion US dollars by 2023. The global pharmaceutical market is growing at a rate of 3 to 6% annually. India ranked 14 in global market with sales of 55 billion US dollars, and it is growing at a rate of 15% annually. Indian pharma market is third largest by volume and 14th largest by value in the world. It is said that it is contributing about 10% of global production of pharmaceuticals. The growth rate of 15% is quite high in comparison to the global rate of 3 to 6%. Pharmaceutical industries in India are developing in terms of skill and technology and have got recognition by several international agencies. Friends, India have the highest number of US FDA compliant units outside the USA, which are 75 as compared to 27 in China. The growth of Indian pharmaceutical activities rests in the hand of qualified and skilled pharmacists only. The Drug and Cosmetic Rules 1945 can read perfectly by qualified pharmacists who are generally appointed in the pharmaceutical sciences, Food and Drug Control Administration, and at a government drug laboratory. The above figures of growth can be further improved provided if the qualified pharmacists possessing the qualification of B.Pharm, M.Pharm, and PhD handle the drug and medicines. Friends, they say change is the only thing constant, and nevertheless to stand on par with the global competitors in today's changing scenario, pharma education does need a lot of revamping, and definitely the Pharmacy Council of India are taking a lot of efforts towards this. Thus, a paradigm shift is required for just dispensing medicine to patient care. Pharmacists should move from behind the counter and start serving the public by providing care instead of pills only. There is no further in the mirror act of dispensing that actively can and will be taken over by the internet, machines, and or hardly trained technicians. The fact that pharmacists have an academic training and act as healthcare professional puts a burden upon them to better serve the community than they currently do. Friends, on the last week, on the 5th and 6th of this month, the Health Ministry, under the leadership of our Honorable Health Minister, they have organized one Chintan Shibir at Delhi. And the theme of the Chintan Shibir was Heal in India, Heal by India. And all the councils related to the healthcare system, like medical, dental, then the nursing, pharmacy, physiotherapy, even the Ayush and skill councils, they were invited. And Honorable Health Minister is very much positive. In his address, he told that the country is having a skilled manpower, the sufficient infrastructure for all the health related courses. Why we should not serve at a global level? Why we should not grab the opportunities at a global level, and for that purpose, what should be the roadmap of a health ministry and the different councils? And at the same time, how to attract the foreign students in the Indian institutions. At present, we don't have any international equivalence to the different universities. I'm talking about the pharma courses only. On that ground, we should work. We have decided to give a time-bounded course, time-bounded program for all the health-related courses, and definitely the Pharmacy Council of India will work on that, and will try whatever the dream of Honorable Health Minister is there, that will come in the reality. Friends, as rightly pointed out by Dr. Atul Nasaji, that in a COVID, the pharmacists, they have played a very vital role. As a community pharmacist, as a clinical pharmacist, even the pharma industry also. It is said that despite its own needs during COVID-19 pandemic, we ensured supply of medicine to around 123 partner countries, including 59 nations. Our Prime Minister, Honorable Narendra Modi ji, rightly said, I quote, India's pharma industry is an asset, not just for India, but for the entire world. It has played a leading role in reducing the cost of medicines, especially for the developing countries, I decode. This is a statement of Honorable Prime Minister, and definitely we have to work on that. Friends, being an qualified pharma professional, we must guide these pharma graduates properly. Today's key speaker is a renowned person. I hope that his guidance and his suggestions will be definitely helpful to the pharmacists to make their career. I'm thankful to the Indian Pharmacy Graduate Association Telangana for inviting me for this program, for this seminar. I declare that the seminar is inaugurated. I wish for the grand success of the seminar. I hope that the fruitful deliberations will be there, and the IPGA will come out with a concrete roadmap for the development of pharma profession and for getting the good opportunities to the pharmacy graduates. I'm thankful to all of you for inviting me and for hearing me. Thank you very much.
Thank you very much, sir. Thank you very much for sparing your valuable time, and your voice has been reached to the members across India, including participants from Rajasthan, Kerala, Telangana, Madhya Pradesh, Andhra Pradesh, Uttar Pradesh, Haryana, Punjab, Tamil Nadu, Karnataka, and Maharashtra, and so on. Thank you very much, sir. And I am handing Mr. Ranap Reddy to take over the technical session. Thank you. Over to Mr. Annapareddy Bhaskar Reddy. Unmute, Mr. Bhaskar Reddy, unmute, please. Please unmute.
Able to hear me, sir? Audible?
We are here.
Thank you, Koteshwaraji. Before I get into my privilege to introduce today's guest speaker, Ranjit Barshikar, sir, at the foremost, I would personally and on behalf of the institute, the association, with the permission of the national chair, Dr. Atul Nasa, and we all thankful to our guest speaker as well, sir. So, getting into the introduction, Ranjit Barshikar, sir, it's my privilege to introduce such a senior, multifaceted pharma professional who is having a more than 50 years pharmaceutical experience with a career span of more than 50 years, including the quality management, R&D, and a global regulatory affairs as well, sir. It's my privilege. And I believe that you are the most senior professional among all who are been in this live session, and very few people like you, sir. Going into the education, Dr. Ranjit Barshikar has finished his MSc Biochemistry back in 1969 to 71 from the Pune University. He presently rendering his services as a CEO, Quality by Design, CGMP, and consulting services in biopharma and pharmaceutical companies in many sectors and many parts of the world. And he is the most impactful healthcare global leader, quality advisor, including the United Nations, MPP, and of the Geneva. And he is one of the most rare personality of grabbing the Quality Champion Gold Award by the Quality Council of India. And this is the most privileges award that Ranjit Barshikar has ever gone. And he has traveled extensively across the globe to attend the various international conferences as a chairman, as a speaker, and given various presentations on all aspects of the pharmacy, including the CGMP, QBD, PAT, GCP, GLP, and US 21 CFR Part 11, and technology transfers, and operational risk management and vendor development, and and IQP and other ISO and risk management aspects, sir. And going into he has written he is an author for many articles and rendered many interviews to the and international journals and TV channels and the pharmaceutical and topics of the pharmaceutical manufacturers and pharmaceutical technology. He was nominated by the IPA as a new ICH experts committee, and as well as served as the IPA, IDMA, ISPA, and Gujarat Council of Biotechnology member for several years. Going into his professional experience, he has worked with the world's topmost company, the Pfizer, quite a few times. Sir Barshikar, sir, I was a past employee by Pfizer New York, and he worked as a vice president for Leica Labs and Sun Pharma. Then time it was Ranbaxy, and then he was appointed as a member of editorial board of Journal of General Medicine, England, and he also worked as a quality advisor for the PricewaterhouseCoopers, which is a consulting, prestigious consulting for United States since 2010, since till now. And with all this, I conclude that he is a very expertful, experienced, and we all expect a reasonable and guidance from him with the senior most professional of the country. And thank you, Ranjit Barshikar, for being our keynote speaker of the day. And we are expecting you a great presentation from you to guide the younger generations of the pharmacy graduates of the country today. And we respect you, individually as by the IPGA. We are thankful to you for giving us your valuable time many times for the IPGA. Thank you very much, sir. Thank you. Now I handing over to Dr. Ranjit Vashikar. Thank you. Thank you, sir. Over to Ranjit Barshikar, sir.
Unmute, sir. Ranjit sir, please unmute.
Yes, done. Thank you. Thank you very much for my introduction, and I appreciate, and this is my privilege and honor to be once again with IPGA national and as well as South Zone webinars. Earlier times, we discussed a lot about risk-based auditing process. Then we also discussed the digitalization activity, etc. in the past. And now today I'll be discussing, as requested by Dr. Koteshwar Rao, about the pharma careers, opportunities and challenges. So it's my privilege to be with you once again, my friends. And you have been always encouraging me as a speaker as well to be part of your activities. So I'm thankful to that. And I'm very much privileged today that you have invited Dr. Pramod Evleji as a chief guest. And I'm very much honored with his presence today and his excellent talk as a chief guest and guiding all the pharmacists in the country as a president of Pharmacy Council of India. Thank you very much, Dr. Pramod, sir. I really appreciate your time and presenting today a nice thoughts about the growth of pharmacy profession and what is expected from
Thank you. Thank you very much. Thank you very much.
Yeah. Now, if you permit, I would like to move ahead with my presentation on our key subject today. Okay, here we are. I hope you all are seeing the screen.
Yes, sir.
Great. So thank you very much again and have a patience for another hour while I discuss this. And whoever has any questions, please put it in a chat box. We'll try to answer everyone, time permitting. Otherwise, you can communicate with the Dr. Koteshwar Rao, and then he will send all your remaining questions, which I can answer later. And opportunities and challenge. The reason why it has been told to me to discuss these opportunities and challenges is that today India has been having a great opportunity, especially in last 2 years of pandemic, to become a great source of pharmaceutical products in the world. And India is looked at by the world because of the excellent skills we have in India through pharmacy colleges, be it D-Pharm, be it B-Pharm, be it M-Pharm, or PhDs. In all the areas, our students, after graduating or post-graduation, are doing excellent work worldwide. And we have a great talent force in India. That is an asset which nowhere in the world has. So I give full credit to all the pharmacy colleges in India, Pharmacy Council of India, and other related institutes. And I really appreciate the wise words communicated by Dr. Pramod Evleji of our health minister about his meeting on last week, probably 5th or 6th in Delhi. So moving ahead about these challenges, which I am going to discuss specifically, why further, even though we have a skilled people, skilled students, still we have some challenges, and why in today's context, which I'm going to mention to you a little later. So let's move ahead. As usual, this is a disclaimer I have for my presentation. There are certain copyright slides in this which you cannot use anywhere, and if you need to use it, you will have to take proper permission on that. Look at the brief of Indian pharma industry. My friends, my dear students, and all the participants, before we actually move at the career, I would like to brief you that why you are in the excellent profession now. Why you are this present profession, your entry is at a right time in the in the pharmaceutical profession as a learning program through various institutes all over India, because it is our pharma industry is highly knowledge based, my friend, and that is the key, and that is where all of you have contributed in the past and you will be contributing in future as well. We are third manufacturing globally by volume. Our Indian industry is 10th globally by value for pharmaceutical products. Today, we are $42 billion business as published for 2021 year. And we are exporting to more than 200 countries. Out of these 42 billion, we are exporting, my friends, $25 billion product to the world. We have around 3,000 companies in India, of which around 10,000 plus manufacturing sites, where around 500,000 personalities are working and supporting the pharmaceutical industry. All this is published by a FICCI Ernst & Young document in 2021. You can always visit and have more information about this. And that is why our pharmaceutical industry is known as sunrise industry. And these pharmacy students, you will really enjoy working in this pharmaceutical industry, and you are at the right time, whoever has taken new admissions or last 1 year or 2 years for this sunrise industry. And as our chief guest, Dr. Pramod Evleji has mentioned the Prime Minister quote, we are known as pharmacy of the world, remember. And this is very rightly quoted by the Prime Minister, and we are living up to his expectations, and therefore you are in a noble profession, my friends. There are key segments for pharmaceutical industry: API, manufacturing, as well as trading of the, look at in between. I'm going to also mention to you the opportunities depending on your business acumen as well. So API manufacturing and trading of the bulk drugs as well, or formulations. CROs and outsourcing companies, biotechnology companies, and testing laboratory. These are the key areas for pharmacy students to look for the opportunities. In bioindustry, where biopharmaceutical is almost around 62% of the business, in addition to bioservices, bioagriculture, bioindustrial products, and informatics, though it is at a very nascent stage. Export performance. Now here you will see the graphical presentation of the export performance, that right from 2014 to 2020-21, we have from 15 billion to 21 billion we have reached. Almost $1 billion of exports we are doing every year, increase in the business. And this is to 202 countries. And in 2021, our exports have gone up to around $25 billion, my friends, which is a very, very creditable to pharma industry. From export outlook perspective, when we talk of over 55% of the production to exports, the North America has around 36%. And you see the Europe around 18 and Africa around 17%, comprising of around total 76.5%, including 19% of API and intermediate, 3% of surgicals, and 2% of the Ayush and herbal medicines are exported by India. If you look at the projection of India for next decade, current decade rather, is now it is expected with the current speed to achieve $90 billion by 2030. And with an aggressive style or in aspiration case, it can go up further $40 billion, that is $130 billion business. So look at the tremendous opportunity, my dear friends, you have now in future ahead. And that is why I said earlier, you are in a right profession, you are in the right pharmacy education system at the right time. Look at the top companies of India, my friends. Obviously, Sun Pharma is the top company, no doubt about that. And it has grown very well. Sun Pharma, then Abbott. Abbott is a global organization. And then Cipla, then Cadila, then Mankind, Lupin, Alchem, Torrent, etc. companies which are doing very good business in India. And you have a great opportunities to work with such beautiful organization, global organization, as part of Indian skilled pharmacy graduates, postgraduates, and doctorates. Look at this scenario here. Now, we discussed this about the Indian exports category wise earlier. This is a brief of year 2021, and you see the percent change is around 26% in Ayush Herbal, 14% in bulk drugs API, 20% in formulation, and surgical 7%. So total 18% is a growth of Indian pharmaceutical for exports purpose. And individual organization which are ranking worldwide topmost 20. The list I have mentioned here, which is published by Pharmaxil, the serially numbers and their rank amongst top 20 in the world. Generic companies are mentioned here. And this is a big pride for all of us that eight Indian generic companies are featuring in topmost 20 generic companies in the world. Sun Pharma, Aurobindo, number 2, Cipla number 3, Dr. Reddy's number 4, Lupin, Intas, Zydus Cadila, Glenmark. So it's a great achievement by Indian generic companies. My friends, you should also know which are global regulatory agencies monitoring our companies in India if they are exporting. And also in India, obviously, Indian FDA, CDSCO, US FDA, WHO, European agencies, MHRA, UK, MCC, South Africa, TGA, Australia, ICH guidelines, and all other, there are several other agencies. I mentioned here key regulatory agencies monitoring our production all over India and abroad as well. Several of our companies are having manufacturing setup in USA as well as in Europe and several Asian countries as well. Now look at this number of approvals which Indian pharmaceutical industry has from global regulatory agencies. This is again published by Pharmaxil report. In USA, about 770 plus manufacturing sites are approved by US FDA as on June 21. And similarly, you see the numbers of Europe and WHO as well approval. In Europe, around more than 1700 CEPs are approved, and by WHO has certified more than 2000 manufacturing sites in India. So these are all great achievement which we are having as a pharma organization's performance. Our government regulatory agencies, my friend, activities, their initiatives have recently started very nicely in certain areas to make the changes. In 75-year-old 1940 Act and 1945 rules are getting changed now. Anytime they will be published. The key area here, which is kept in mind for these changes, was improvisation in quality standards, keeping in mind our high ratings worldwide, removal of licensing difficulties in the government authorities, and they have a special committee suggested for these changes, and I have been invited to work on this committee, being part of this committee to suggest the changes to the government. It has been, lot of suggestions have been given, and also Government of India has made the Pharma Vision 2021 a very good document. I request all of you to have a look at it. Union budget initiatives, 2.23 lakh crores spending planned for the coming 6 years, out of which government had allocated last year 35,000 crore for vaccine, which has gone up now up to 60,000 crores. Government has initiated production linked incentive, which we call it commonly as PLIs, and strong support to R&D and startups in India through Startup India, Make in India project, Atmanirbhar Bharat. So over the past 25 years, the generic companies, new molecule entity India has given a very good opportunity for growth in this area, which is exciting time for us in the pharma industry. Keeping in mind that, I want to quote you the very recent example of developing an excellent vaccine, Covaxin, by Bharat Biotech in Hyderabad, which is a pride to all of us, my friend. In shortest possible time, they developed a very effective vaccine for pandemic situation, and which is also getting exported. It has got World Health Organization approval also 2 months ago. So it's a great achievement for India, my friends, and that's a credit to our scientists in India. As I mentioned to you, there are several companies now coming into the vaccines, the Zydus Cadila, Bharat Biotech, Serum Institute, Covishield, which has tied up with AstraZeneca, Dr. Reddy's with Sputnik V, and Biological Evans, Hetero Biopharma, and we are supplying more than 70 countries the vaccines manufactured in India or imported or tied up as a partner. So India has been shot up to the global fame because of vaccines as well. So far, my friends, more than 170 crores corona vaccine doses has been administered in India till 6th of February 2022. By this time, it may be 171 crore as well. So it's a great achievement for our country, and we are now in a very much comfortable stage. Some experts are saying we are not in pandemic now, we are in endemic situation. I hope everybody knows endemic situation. PPE kit has taught us a very good lesson, and from zero to we have become the topmost export country to the world in PPE kit, which is a very good example. And our Prime Minister regularly quotes about PPE kits as well as the vaccine manufacturing in India as a pride to our nation. So the strengths of our pharmacy of the world in India is strongly backed by innovation capabilities and cost advantages, my friends. My dear students, look at these numbers that our manufacturing cost is 30 to 40% lower than China and in Europe as well. So we have a big strength here, lower level cost, skilled labor force, and one of the main reason is English speaking workforce. And you are very much part of this, my dear pharmacy students. So local talent into the pharma industry by way of B Farm, M Farm, etc., is much stronger than China, and which is a big strength which no one else is having in the world. Now look at this opportunity, my friend. Why we are talking of opportunities? One of the opportunities is in next 5 years, look at the number of pharma branded products going off patent. Whenever there is these products which has a patent in the world, branded products in the world which has patent get expire, there is immediate opportunity to generic companies in India to market these products as generic products. And look at this, more than $250 billion opportunity is now open till next 5 years for India. Especially in next year, there are 63 products which are going off patent. In 2025, 50 products are going off patent. In 2026, 54 products are going off patent, which are available to all the generic companies to develop and market worldwide. So it's a very, very big opportunity for us. And that is why I'm saying you are in a right profession as a pharmacist, my friends. When you look at the actual career perspective, here are the opportunities for you, my dear students. Whether you are D Farm, B Farm, M Farm, or PhDs, I'm going to discuss with you about the conventional options you have ahead in various departments of the pharmaceutical industry. Right from research and development, my dear friend, research and development to academic, clinical trials, hospital pharmacies, pharmacovigilance, manufacturing of the pharmaceutical product and APIs and intermediates, regulatory affairs department, quality control and quality assurance, medical writing, journalism, and marketing and sales. All these are the conventional opportunities, and you can always opt for these depending on your liking, depending on your knowledge base, depending on the style of presenting yourself, whether you would like to go to marketing, whether you would like to go to sales or in research base. So it depends on that, what are your likings, and then you can always opt for these. Let us see some of these career opportunities, conventional. In R&D, look at this in R&D. It is bulk drug manufacturing opportunity, right from research and development, a new molecule entity. You can enter yourself if you have a liking for active bulk drugs or formulation development. It's a huge activity there, huge opportunities in formulation development as well. There are several companies who are investing in research and development to the tune of 5 to 10% of their business. The amount invested by these companies is between 5 to 10% of their business, which is a big money. In analytical development, technology transfer in R&D, you have intellectual properties, opportunities to guide the company, to guide R&D, what are the things advantage can be taken off, which you can patent, or you can go out of infringement of the patents. So you can guide the organization. You can always opt for clinical research if you have interest in that, where you can see this below graphical presentation there, the medicines information, quality assurance in clinical research, the technical services required, medicine management, the warehouse activities, the information technology is a great opportunity now and future as well, which I'm going to discuss at the end. And education and training, there's several opportunity in clinical research, and also in R&D, you can have an opportunity to work in regulatory department. Understand the global regulations, the requirements of global filings of different countries, of all the 5 continents, as well as the monitoring the regulatory compliance of manufacturing sites as well. In quality division, you have again several opportunities. Now the good organizations have started quality assurance department in R&D itself. Obviously, manufacturing and compliance has a quality assurance. A key role is quality assurance. And my friends, why I am focusing here more and discussing this, my dear students, is in today's time, and since last decade, quality function has got very high importance in organizations. Earlier days, during our days, it used to be service department. And now, because of several global problems of compliances, especially US FDA, the things have changed completely. And management, the top management is listening now on quality department more. Their views, they are not pressurized from compliance perspective. So you have a tremendous freedom of opportunity to work in quality division, irrespective of whether it is quality assurance or quality control in R&D or manufacturing or outsourcing monitoring, training, validations, or in quality control as analyst, or in process quality control, technology transfer, method development, etc. So this is a big opportunity. You are at a very comfortable stage in quality control now, because it is looked at a very, very important division, and this is reporting to the top management now. So it's a big paradigm change. In manufacturing, oral solid dosage forms, the sterile manufacturing, production planning, inventory control, compliances, warehouse, also in ointment, liquid manufacturing, etc., etc. There are very good opportunities for you if you have a liking to work in manufacturing division. In healthcare hospital, you can go up to CEO as an administrator. If you have a liking in finance, in addition to the pharmacy, you have a plus point to go also as a CFO or a CEO. You can also work in project, because every key organizations, every year there are several projects coming up for the growth. So there is a good demand for people working in project department, which has a background of pharmacy, healthcare, policy analysts. There are, for even just simple examples like government offices, insurance, private enterprises. There are several programs like prevention of diseases where health services managers are required. And you can also have medical entrepreneurship as well, and health information manager in medical technologies and university-based programs. There are several newer career opportunities for you. The medical and scientific services. Now, this is a great opportunity. And communications. Now, this area, many people are either not aware or remains untapped, because several organizations have now communications director. And if the person has a pharmacy background and has a skill of communication, has a very good vocabulary, so which pharmacy background, scientific background, communication skills, you have a very good opportunity to report to the topmost person in the company. If you want to work in the organization, you can go up to communication director or president of communication, directly reporting to the managing director and chairman. Pharmaceutical journalism, and there are several opportunities here in recent times. In last 5 years, there are several people who started the journals activity globally. And there are several journals now, like the science, the nature, the pharmaceutical technology, the bio pharma technology. The several such journals are there. If you have a liking of writing and editing skills, they give opportunity for you to work with them because you have a pharmacy background. Scientific publications you can do yourself, or you can start your own journal with a right background. Medical tourism is also a big opportunity. Several people are coming to India for a health checkup and the treatment and the operations, because of the doctors in India are highly skilled, and Indian hospitals have very good facility now to treat the patients. Also, the additional advantage they have is the cost of the treatment is much lower in India than the global market. So we know there are several people coming to India, and they stay in 5-star hotels and go for regular treatment to the hospitals, big hospitals. So this communication between the hospital and the patients overseas has become a big business now in India, my friends. So you can be an asset to that kind of career opportunity. Insurance company, no doubt about that. They are always looking for experts from pharma to guide them to monitor the insurance activities of various insured persons or families. And now, my dear friends, another excellent opportunity which has come up, especially in last 3 years, is on e-pharmacy. e-pharmacy is very big business today in India. Let's see these opportunities and why. Now, these e-pharmacies business, I'm sure every one of you are watching television some or the other time, whenever you get free time during the day, and you come across now several advertisements on e-pharmacy. Now, this increased attention of e-pharmacy from the government of India and as well as investors is for more in last 3 years. This market today, look at this, my friends, my dear students, look at these numbers. This opportunity today is worth over 5,000 crores today in India, which has around 35 startups in India. And these people have started this business as an entrepreneur with pharmacy background. So they are doing very, very good business. And it is anticipated now we will cross 46,000 crores of business in India in next 4 years by 2025, my dear friend. So such a great opportunity in e-pharmacy. Now, why this opportunity is there? Now, if you see currently more than 9 lakh independent retail pharmacy stores are there in India, all over India. And they are still not able to meet the requirement of whole Indian populations. So they are only meeting the requirements of 60% of India. So there is a great opportunity for the e-pharmacy business, and which we have realized ourselves, because every family there is a need of some or the other product. And in last 2 years in pandemic, we have experienced many of the senior citizens who cannot go out, or even normal citizens, younger population, during lockdown could not go out, where e-pharmacy supplied the medicines at home within 2 hours to 24 hours time frame. So this was a big opportunity for this business to grow, and I'm looking at this as a future growth as well, my dear friends, for e-pharmacy. There are some of these 35 startups. I am listing here where we see, many times we see advertisements is Farm Easy, 1 milligram, that is floated by Tata Group, MedLife, MedPlus, NetMeds, TrueMeds, Health Card, M Chemist, Medicine Way or Apollo Pharmacies. Apollo is especially from South, but all over India they have spread up. And this e-pharmacy, these are just few examples. So you can, if you are in having a business acumen and interested, you can always opt for this. How this works, my friend, how e-pharmacy works. So I thought to share a few minutes on this with you, that about e-pharmacy. Before e-pharmacy, or many cities where e-pharmacy business is not there, people are directly getting medicine from the retail stores or pharmacies, chemist stores. They go with the prescription and they purchase it directly. Or it is through their relatives they purchase from the retail pharmacies. So dispensing and distribution was earlier situation. Today, if you see from that perspective, the patient is scanning. There are 2 ways to communicate with the physician in e-pharmacy business, or to have the medicine, my friend. My dear students, look at this. Please be attentive, because I would always vouch anyone, if you are interested and if you get good finance support, government is also giving for startups, I think minimum 3 crores or something. Please explore this possibility first to start your own business. Patient, what he does today, either he scans the copy of the prescription or takes the photo of the prescription and send it to the pharmacist shop or the e-pharmacy company, and they immediately tell you the price and you are paying for that, or they give opportunity of COD, means cash on delivery. So you can pay them when their person comes to deliver the medicines. Okay. There is another way for that. When the physician is or your doctor is giving prescription, the patient is having a QR code, and through QR code he is communicating via email to the pharmacy or e-pharmacy, and which is digitally signed. So it goes automatically on the record, saves a lot of time of everybody, and you get the medicines at home. So there are several licensed pharmacies in India. You can always visit their websites of those e-pharmacies. So the communication between the licensed pharmacies to the consumer is the key. And these communication channels, you can always have a different operations or different options of communicating with different e-pharmacies and go through this kind of process. But you have to act, my dear friend, under the following regulations of Information Technology Act, and very good clarity is given on the website. If you want to open e-pharmacy, it's a good guideline given by Government of India. So look from that perspective. So this potential of e-pharmacy in India is very, very big. And this opportunity, several startups are already grabbing. And as I told you, this has a potential of growing business up to 46,000 crores in next 4 years. Remember, so it's a huge demand across wide range of products of different organizations, and this is going to increase day by day. So give this try as well if you have interest in e-pharmacy as an entrepreneur. So benefits are for everybody, to the patient, to the regulator as well, because they are regulating now this as well, and pharmacies. Everyone will automatically get benefit on e-pharmacy business perspective. Look at this ad. Why I am showing you this? This is an ad coming in the newspaper or magazine. It's Farm Easy. Side by side, not only supplying the medicines to the directly to your home, but they have started the pathological lab activity also. So this is addition further. Look at how they are growing, e-pharmacy people. So few of them are doing it, but it is worth exploring that as well in today's time. And look at these ad. Full body checkup with vitamin D and B12, 800 rupees. What it includes? Lipid, thyroid, kidney test, liver, CBC, etc., etc. So this is additional business as an extension of your e-pharmacy activity. So you see the opportunities. There are also, my friend, newer medical interventions as an expert in vaccine, like Bharat Biotech has done. And I was an advisor to Serum Institute chairman, Dr. Poonawalla, for 1 full year for their quality system setup. And they are really doing excellent job in manufacturing the vaccines. They are very good facilities. Their facilities also approved for different products by US FDA and several global regulatory agencies. They are very, very happy with this Serum Institute facility, and they have a global tie-up with multinational as well. There are other opportunities in biomonitoring technologies like human computer interfaces and regenerative medicine to repair the tissues or replace the tissues of any individual requiring that kind of operations. You have, even in pharmacy practice, a great opportunity right from healthcare system, the pharmaceutical and the public system, where all these your skills are required from the pharmacy practice perspective. So what is pharmacy practice? I'm sure you are aware of it, but look at this. The mission of pharmacy practice to provide medications and other healthcare products and give services as well to help people and society to make the best use of their services and the healthcare products. Now, this healthcare product also includes several activities which I am coming up now. This is one of the requirement for healthcare product is medical devices, my friend. You can also opt for this. This is a very good business strategy. The medical devices are now becoming household remedial. There are several medical devices available to check your own blood yourself for sugar content or other parameters, your blood pressure, your pulse rate. All these facilities are available as a medical devices at your home. You can do it, and you can do the business into these, getting these products and selling it into the market. So there are other opportunities like screening, diagnosis, treatment, and restoration with the help of medical devices because of improved health outcomes and reduced burden on the medical resources. Now here I would like to give quickly one example. One of my relative had a problem of the eyesight. Suddenly the pupil was stuck and could not look 180 degrees. We usually we don't move every time our head to watch the things on the side. Our eyesight, pupil moves on right and left, and that's how we see here and there. Where these relatives, one eye was completely stuck up because of some problem of arteries in the brain, and that person came to meet doctors in India, and the doctor did complete robotic operation with the help of robots at his service, and perfect accurate operation. He removed all those clots in the brain arteries, and the eyesight was completely restored, and this operation was done in maximum 2 hours, and it was invisible without cutting any part. Look at that system, without touching the brain from the skull area. And this is a great achievement Indian doctors are having. And there he has used few medical devices and robots also as a medical device for operation of the patient. So when if you are interested in medical devices area, my dear students and friends, this opportunity is significant, and this is going to be, look at this opportunity of medical devices. In another 4 to 5 years, medical device business will go up to 25 to 30 billion. Remember, 25 to 30 billion business in India. So healthcare completely, which includes medical device, where you start your business as a trader or work in manufacturing of the medical device as quality person, in general manufacturing activity, operations, procurement of the medical devices. You can do that also. Testing of the devices, transcription of the labels of the devices from different languages. In sales and marketing, if you like, or if you have a continuous talkative activity, if you like that, your smiling face, you like to talk to communicate with people, impress people, and marketing as well, designing and labeling. So medical device also is going to be a big opportunity for all of you. As an entrepreneur in IT related activities, in automations, as I earlier explained to you, e-pharmacy, patent expert, you can be medical transcription. This is a big business in several cities. As an auditor or an inspector, after having sufficient experience and have a good regulatory knowledge of inspections, you can start your own this consulting in the auditing activity or join the government agencies. Packaging material manufacturing, you can do yourself as an entrepreneur, or you can start your training institute as well. You can do this MBA as well if you are interested, and move towards having your own organization for a business perspective. There are top recruiters worldwide for MBAs from an entrepreneurship perspective. As one of the largest is Etiquette, the global, the TCS in India, the Infosys in India, the Chrysil, Deloitte, ICICI Bank, HDFC, Reliance, JP Morgan Chase, global organization. There are several companies who look for MBAs in pharmacy. You can always have a very high weightage to work in the globally. But keep in mind, my dear friends, when we have so many opportunities, we have to develop ourselves and take everything as a challenge. And from challenges perspective, it is important that we have a positive attitude, my dear students and friends. Personality, no doubt, makes a difference, but positive attitude makes more difference. Communication skills, I have described already sufficient on this. Your shop floor relationship, how do you communicate with your colleagues, friends, even in colleges, or when you enter the industry, or when you start your own business, how do you communicate? Your maturity always gives back with a positive things to you. People work more with you happily, because we want happy surrounding all the time, positive wise surrounding around us in the organization. So this is positive attitude is a great skill which we need, and this is a challenge for us always to remain smiling, to remain positive, working anywhere. English, no doubt, is very, very important for the working in pharmaceutical companies. The commitment to the job, the dedication to the job, or owning your own work in the organization is key thing. You also need a effective planning, my dear friends, my dear students. Effective planning is also the key, and no doubt that you have to be a teamwork, team player. You have to be part of the team. You cannot say whatever I say is everything correct and you have to follow me or do whatever I'm telling. This is not the right one. You have to be part of the team, work as a team player in the organization. And this is possible if you have a sufficient knowledge. So don't waste your time in your colleges here and there. just for the entertainment, 1 or 2 hours is fine during the day, but don't waste your time. Learn, educate yourself, discuss with your teachers and professors. The need of communication is important. You have today's time, you are having a Google as your right hand, and this Google search is helping you to gain knowledge. In our days, in 50s and 60s, 50 years ago, this was not available to us. Even today now, every day I wake up early and go through several blogs I get globally and pick up the latest knowledge and use it to during my talk for various programs and the conferences. So knowledge is the key. From emerging technology perspective, what I'm going to discuss with you is continuous manufacturing. You should be knowing what is happening in the industry today. It's a big challenge to all of you, my friends. Don't get stuck only with the college teaching, which is important. But you go beyond that. Whenever you go to the colleges as an internship, find out from the experts there that what is latest happening in manufacturing world, in analytical world. Now this one is a continuous manufacturing where in this ultra reactor machine, now we are manufacturing the active bulk drug itself, and immediately it is used to make tablet. So you are not buying active bulk drug substance from market. What you buy is only intermediate. And this is the minimum use of organic solvent, increases the stability of API and increases the shelf life stability of a finished product as well. And I was extremely lucky to have met with the innovator of this machine, Dr. Alan Meyerson from MIT, USA, where he had tied up with Novartis. And this diagram, he has allowed me to use it. And this is the, now it is underutilization. Today, only few companies are using this technology in India as well for critical steps, not complete. But this technology is ultra lean manufacturing, which is using automated testing of critical process parameters. So it's a great boon to us. And this is so you should learn also what are the new technologies the pharma industry is going through. 3D printing. So we are fully aware there are so many technologies in 3D printing where from the plastic manufacturing to the hands and legs mold manufacturing for needy handicapped people to the now medicine manufacturing. Now there are several children, they don't like to take medicines because they feel it is bitter. And you can make this medicine in their characters, with Disney characters which they like, and give this kind of shape on your screen, and they happily start chewing it. And you are giving them medicine by changing the taste which the children like. So 3D printing is also getting used today in India by some of the South Indian entrepreneur startups. They are making the houses 2 BHK, they are making in 1 week with the cost of around 6 lakhs maximum. In 1 week, they are making the house ready for you with all due permissions and with the help of 3D machine, the 3D printing technology for house construction. So it is a great thing happening now in the world. The same thing has happened in products manufacturing as well. So importance of digitalization, you should be reading. you should be knowing, my dear friends, as a future endeavor in the pharma industry. And the whole industry is changing now slowly. In next 5 years, it is going to be complete change and a big paradigm change in the industry manufacturing activity. Our Prime Minister has launched the Artificial Intelligence Initiative. And this is, the government of India has started 2 courses also for that: Artificial Intelligence Awareness and Artificial Intelligence Appreciation, which is about 2 hours program. So it is free of cost. So digitalization is going to play a large role in Indian economy by 2025, and we have to be ready ourselves to play our role. The government of India has a document through Niti Aayog on artificial intelligence on your right side. On the left side, US FDA has proposed a guideline on as a artificial intelligence as a medical device. They are treating this software, artificial intelligence and machine learning based software as a medical device, my friend. And that is why I discussed with you earlier about medical device opportunities. So digital literacy is very important, and now you will have to go out of the way to understand this activity, what it is, why it is 21st century opportunity for you. As digital literacy of the employees is also required to the companies, and now it is everywhere in the life. Now all of us are handling smart mobiles, my friend. That is a digital operation. Gaining competitive edge, it's a big advantage. Professional excellence. You can go into the entrepreneurship with the help of digital literacy, because this is going to be agenda for tomorrow's betterment. And with the upgradation of the status of the profession, automatically it will help us as a pharmacist to support as a career in future. Government has come out with the healthcare as a now as a digital healthcare, and there are several programs through which this government of India is operating as a digital India. There are several opportunities which you have as artificial intelligence in every activity of pharmaceutical industry, my friends. R&D, clinical research, manufacturing, supply chain, marketing as well. Artificial intelligence people are using now. Overall, it is getting also used as a robotics performance, artificial intelligence, and as well in training part. A person can, in a remote area, can teach from Los Angeles to Japan in Japanese language, though that trainer doesn't know Japanese language. So it's a great boon, good technology by even Microsoft Azure technology has come out with this artificial intelligence and robotics in manufacturing of the pharmaceuticals. As a Pharma 4. So what is digitalization then? Naturally, you will have this question, my friends. What is digitalization? You remember this in earlier days, more than 50 years ago, the thumb impression was being used very commonly all over India and villages. And then we changed from thumb impression with the help of education by signing ourselves. More education, better it is always. And then what is happening today? Now we came from thumb impression to signatures with the help of education. Now from signatures, where are we going now? With the help of digitalization. Back to thumb. Now if you have Aadhaar card, right? Everywhere the Aadhaar card, your eyesight is seen, your fingerprint is taken. What is that? It is thumb. So we are back now as a digitalization process to the thumb impression, finger impressions, or even in industry or even in some of the colleges, you are given entry card, which is all digitalized card. Your fingerprint, your face reading, everywhere now this digitalization is already being used. So it's a way forward, my friend. The skills, knowledge, understanding enable us to create and shape practices for digital technology. And also, it is very important, not only for students, but as well, educators also need to be digitally literate. And several times I have spoken on this subject in various universities and the colleges that the Pharmacy Council of India should look into this aspect and start considering the digitalization and the literacy as a part of either syllabus or allow the various institutes to start their own courses. I am aware of some of the institute, they are planning to start artificial intelligence special courses by hiring the experts. So it will be good. And I came to know recently in one of the article that Pharmacy Council of India is doing it now, looking into this and also planning to consider artificial intelligence in future. So I'm happy what Dr. Evle sir mentioned as a chief guest in the beginning about various initiatives the Pharmacy Council of India is taking on. So my friends, as a special courses, you can opt for, or also you can yourself access the website. As an individual, there are several institutes giving free education on this area. And advanced version is paid. Basic things as a knowledge and this utility, you can have free courses which is given by Coursera, one of the common site. Even the IBM, Microsoft, the University of London, etc. They are all offering free courses in various such technologies, machine learning, deep learning, artificial intelligence. A lot of these things are already available for us. So future is now, my dear young friends. You must unleash your potential, exploit your potential of skills and your intelligence to go into these so many opportunities you have in future as a pharmacist, and enjoy the sunrise industry, my friends. And I'm sure that you will do your best to go into digitalization learning activity and do your best to support the pharma industry. My request to you is look yourself as a startup first. And I'm sure you will succeed with the support which you are getting all around. And if you are not interested in the business, go into the various opportunities of career which we discussed just now. And most important, one last comment for you is a student asked a wise man, my friend, tell me, sir, in which field I should make my career. A student asked a wise man, tell me which field I should make my career. And what the wise man told the student, look at the answer. The wise man replied, be a good human being, my friend. There is a lot of opportunity and less competition in today's world. So don't forget this. Be a good human being. It is very important in our life. That gives you tremendous satisfaction beyond your career as well, my friends. So thank you very much. Proud to be an Indian. Jai Hind. Thanks for inviting me today, the Dr. Koteshwar Rao, and I am really happy that you invited me today and IPGA as well and given me this opportunity. Third time with you and IPGA. I appreciate very much. Thank you very much.
Thank you. It's our pleasure, sir. And really, there is no words to express, sir. Really, you are sparing lot of time and knowledge to the field of pharmacy, and for that which we are grateful. And Mr. Annap Reddy, please. Mr. Annap Reddy?
Yes, sir. Audible?
Yeah.
Thank you, Ranjit Barshikar Sarji, and they have explained various novel things for, outline of the other alternative or opportunities for the graduates of the pharmacy. And as well, thank you very much for your nice continued with more elaborative and knowledgeful speech, sir. Thank you very much. And we continue to have you in more and more sessions. Thank you, sir.
Any questions you have seen from the chat box, you can coordinate with Dr. Bashikar.
Yes.
Have you gone through them?
Yeah. So I'm able to see not many questions here, but
If there is, you bring to the
No.
notice.
yeah.
I'm seeing some comments coming in here.
And
Excellent session. Very nice. Is someone
I mean, so as long as I see the comments, but and virtue of consolidating the entire the lecture of Dr. Ranjit Barshikar, and I would like to claim all the participants here. There are a lot of opportunities in pharma and ancillary, traditional and non-traditional opportunities in the field of pharma sector, including the pharmacy, industrial, bio, clinical research, pharmacovigilance, as the guest speaker has mentioned. And only the question is improve the competency. I mean, the simple words with all the lecture by the keynote speaker of the day, he wants us to have the competency to grab the job of the time of the, and same time, and thank you, sir, for letting all the students know that this is the right time, as the pharmacy industry is much growing, and is the right time to be the part of the pharmacy industry, and in whatever the mean it is, only not to have be a traditional pharmacist or a chemist in the industry. And you have elaborated all the sectors of the ancillary, affiliated, whatever the non-traditional opportunities that are available. There are a lot of jobs available. The next sessions would be from you, we are expecting, and from the IPGA, that we all continue to elaborate such a way that how to grab these opportunities, how the IPGA will guide the new student generations for all the sectors what you have been elaborated, sir.
Dr. Ranjit sir and Dr. Ishwar Reddy sir, Joint Drug Controller of India, has conveyed best wishes. He witnessed for some time, and Dr. Annada Das, former Drug Controller of Odisha, also witnessed the event. And there is a routine message in the chat box from Mr. Jakaria Noorani from Ladakh. There is a problem regarding their registration, brother. For that, please contact me after this session. I along with Mr. Annapareddy Vijay Bhaskar Reddy, after speaking to our national president Atul Kumar Naza, if necessary, we will come there and we will solve your problem. This is a different part, and several times I have been asking, give your contact number, you are not responding, you are going on posting, which don't have any use. Please contact me after this session. And if anything other things are there, you can contact me through my email ID, inspectordrugs@gmail.com, which I have been repeatedly posted in the chat box. And I once again request all the teaching staff, because there are more than 1,000 to nearly 2,000 participants we observed from all the nook and corners of the country, from all states, including in people from industry, students, teachers, and regulatory also. And I request to strengthen this. We are trying our level best to do something for the betterment of this profession. And I request all the members to strengthen this organization by getting membership in IPGA, Indian Pharmacy Graduates Association, and in which states, so far only 20 states we are running the organization. The balance states like Odisha, Sikkim, Arunachal Pradesh, and eastern country states, Goa and other states, please be in touch with me for starting this organization, your concerned states, and please take IPGA membership also by visiting our website, official website, www.ipga.in. And for other information, please message me or mail me. Over to Dr. Nishit MC for presenting his vote of thanks. Dr. Nishit MC.
Thank you, sir. Respected IPGA National President, Dr. Atul Kumar Nasir, sir. Distinguished Chief Guest of today's function, President of Pharmacy Council of India, Professor Dr. Pramod Yevle, sir. Speaker of today's webinar, Mr. Ranjit Barshikar, sir. IPGA Sub-Zone Coordinator, Kodeshwar Rao, sir. Moderator and President of IPGA Andhra Pradesh, Vijay R. Annappa sir. Coordinator, Dr. P. Rajashekar, sir. IPGA members and other distinguished professionals from different states of India and dear students. Very good afternoon to one and all. It's my great honor and privilege to propose vote of thanks to all who have worked very hard to make this webinar a resounding success. At the outset, I would like to extend my heartfelt gratitude and thanks to our National President, Dr. Atul Kumar Nasir, sir, who welcomed the gathering. He is a great national leader of IPGA and trying to bring all pharma professionals across the country under single umbrella. Under his leadership, IPGA is growing fastly, and we have never seen such a growth ever in the history. Thank you so much, sir, for your support. On behalf of IPGA South Zone and IPGA Telangana State Branch, I extend our sincere gratitude and thanks to our chief guest, the most respected President of Pharmacy Council of India, Professor Dr. Pramod Yevle, sir, for accepting our invitation and to address this virtual gathering. He has spared time from his busiest schedule to grace this occasion. Today, we had an opportunity to hear words, thoughts, and vision for making pharma profession one of the best in the country. Thank you so much, sir, for your time and gracing this occasion. Now, I would like to express our sincere thanks to keynote speaker of today's webinar and CEO of QBD International, Mr. Ranjit Barshikar, sir. It was really a mind-blowing session on pharma career opportunities and challenges. Today, our students have got a lot of information which will truly help them in their life. We have no words to offer gratitude for your valuable presence here. You presented in depth to the topic, talked about recent updates in pharmaceutical industry, post-COVID transformation in pharmaceutical industry, need for soft skill development, digitalization, and many more, and covered all aspects on this topic for enlightening future generation. Thank you so much, sir. We are immensely thankful to our South Zone coordinator, IPGA, Mr. Kodeshwar Rao, sir, for organizing this event. It happened only because of his clear vision, never-ending enthusiasm for inspiring, supporting, guiding future generation for molding their career, and also for betterment of pharmacy profession in our country. He is always a spirit and backbone for growth of IPGA in South India. Thank you so much, sir, for your initiation. Now, I would like to raise my hearty thanks to Dr. Vijay R. Annappa, sir, for moderating this session. By sharing your ideas and worthy information, you have made this session very interesting. Thank you so much, sir, for moderating this session amidst of your busy schedule.
Thank
I extend my sincere thanks to the coordinator, Dr. P. Rajsekhar, sir. Only with your experience handling and timely intervention, we could manage the complete session in time successfully. Thank you so much, sir. The beauty and success of any webinar is the attendance of participants. It's great to see that we have witnessed participation from different states, different sectors of pharmacy, especially academia and student community. We had 1,000+ participants today in this webinar. Thank you all students for your active participation. I am immensely thankful to our national leaders and also active members of IPGA Telangana State for your initiative and hard work for making this webinar very informative and a great success. Finally, I would like to thank all of you present here for making the time to be with us today and helping to make this event a grand success. Thank you, one and all. Have a nice day. Thank you.
Thank you, Dr. Nishit. And before ending the session and before going for, sir, please mute, sir, please mute. Before going for national anthem, I request this link will be open for another 30 minutes. Those who are want to express their feelings, please fill in the chat box and please go see the Google sheet and fill it or save it and try tomorrow. Every day only 100 members will get e-certificate. So don't get excited. After 1 week, if you don't get any e-certificate, please contact me by mail or mobile. I will see that you will get the certificate. So Dr. Nishit, go for, I request the members to stand for national anthem. Over to Dr. Nishit.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Can I leave? Can I leave now?
Yes, sir. Yes. Oh, sir, you can leave, sir. Only for the certificate purpose we will be here.
The chief guests and whoever wants to leave can leave. They have the queries and the certificates can stay and ask for this thing. No technical session anymore.
Everyone, please save the link so that you can try the next day, because only 100 certificates will be delivered by portal for 1 day. You can keep on trying till you achieve, and make sure you are typing your name properly and also the mail ID. Thank you, everyone.
If absolutely no queries about the registration, everyone can leave, sir.
Dr. Rajsekhar, please have a just a write up regarding different participants, details of states, and any important questions. Just to summarize it and we'll discuss later,
Okay, sir.
please.
So all the participants, session is concluded as over. Only the queries regarding the certificate registration will only be allowed, and others can leave, sir.
Everybody have to fill their form on their own. Some people are submitting the mail ID. That doesn't work out. Please fill in the form so that you will get the certificate to your mail straight away.
That's whoever is not able to submit the form you can submit your email if there are any technical issues, but not at this point, sir. Everybody try to fill up the registration form.
Please save the link for first, because today if
Yeah.
that 100 have been complete, you can do it tomorrow.
Yeah.
Mute చేసుకోండి సార్ మీరు.